Hey, what's going on, guys? My name is Anthony Costa. I'm a student physical therapist. With me I have Jade. I'm going to be showing you guys cervical flexion and extension range of motion measurements today. So cervical flexion and extension take place in the sagittal plane. The end feel for both of them is firm. And I'll get started by showing you how to do it. So we have our patient sitting in a straight back chair. This one comes at an angle slightly, but it was the best that I can do with the furniture in my apartment. But the whole purpose of having a straight back chair is to support the lumbar and the thoracic spine. You want to ensure that the patient is sitting upright. Nice posture. So what you're going to do to start is check the active range of motion of the patient. So what I'll have you do, you're going to cue them, go ahead and look down. And when they're looking down, you're going to apply a little bit of overpressure to assess their end feel. So if we're applying overpressure, good, she's a firm end feel there. And then you're gonna next to go ahead and tilt your head back by looking up at the ceiling. When you do this, you're gonna open your mouth, because when you open your mouth, you allow a true measurement of the range of motion, and you can assess the actual, how do I put it, amount of motion that she has, because if the mouth is closed, it can be restricting. So go ahead, open your mouth, tilt your head back. Good. While she's in this position, we're going to assess the end feel there too by applying overpressure. Good. As you see, when I assess the end feel, I'm supporting her acromion right here so that her whole back isn't tilting back in the chair. So the range of motion measurements, normal for flexion is 50 degrees, normal for extension is 60 degrees. Anything below 50 for flexion is considered hypomobile, so you have some restrictions. Anything over 50 is hypermobile, so you have more elasticity in the joint. For extension, anything under 60 is hypomobile. Anything over 60 is hypermobile. Now, just from knowing Jade, she is hypermobile, so there's a chance with this assessment that she has more range of motion in both of the measurements. One of the measurements, if I had to guess, she probably has more range of motion. But so you're going to take your goniometer here. The circular portion in the center is called your fulcrum. That's going to be in line with the center of the ear, the external acoustic meatus. The stationary arm, the one without the numbers, is going to be perpendicular to the floor. Then the movable arm is going to be in line with the nares of the base of the nose. So you're going to start by having your patient look down. Go ahead and look down as far as you can. I'm just moving the hair so that I can see the ear. Good, go ahead and stay right there. So we're perpendicular, and we're coming down with the base of the nares. Good, and then go ahead and come back to normal. So you have to do a little bit of math with this measurement. You're starting at 90 degrees, and she ended up getting to 144 degrees. So you do 144 minus 90, so she has 54 degrees of flexion. She's hypermobile. Next, you're going to do extension. So remember, keeping the mouth open, go ahead and tilt your head back as far as you can. Good, and hold right there. So you're perpendicular. I only have to move the stationary arm a little bit because she has quite a bit of motion here. Good, and go ahead and come back to neutral. Come back down, good. So I ended up with about 8 degrees left, so you do 90 minus 8, so she would have, I should know the simple math. Yeah, she should have 82 degrees of extension. So she has 82 degrees of extension, 54 degrees of flexion. That's how you take the measurement. Some abnormal end feels that you could feel when you're assessing the overpressure would be like a boggy end feel, empty end feel, or hard end feel, and those would definitely be classified as abnormal. I believe that's everything I have to cover, so thank you guys for watching.